Black Like Me podcast listeners. This is Dr. Alex G. I certainly hope that you and your family are well and doing the best that you can to keep yourselves safe and protected. A couple of things that I just want to bring to your attention. One is I appreciate your support during this time of COVID-19. There's so many other things that you can be doing with your time, so many other things that you can be supporting, but I really appreciate that support. Having said that, as I welcome all of you, I want to welcome my latest Patreon member, and that is Kate Hewson. Kate, I want to send a huge shout out to you and thank you so much for choosing to support Black Like Me podcast. We're being listened to all over the world, and it is supporters like you, Patreon members like you, who help us to do this. So thank you, thank you, thank you. I want to also offer a reminder to any of you who would love to hear your names being shouted out on this podcast, and frankly, who wouldn't? You can just go to patreon.com/blacklikeme. There's a link on alexg.com, or you can certainly look in the section in this podcast episode. But again, that's patreon.com/blacklikeme, and just join for $6 or more a month. That at that tier level, I'm going to give you a good shout out. Hey, I also want to let you all know that we have noticed that there's a shift in the quality of on the audio quality of the podcast. Well, that's because we're trying to use equipment that we have at home. We're practicing social distancing. We're not going into the radio studios we normally use, but yet we are committed to using our computers, our smartphones, and Zoom and other platforms to continue to bring you excellent programming. So during this time, we certainly appreciate your patience and your grace in understanding that although the quality might change from week to week, the commitment to excellence and the content does not wane at all. So thank you so much. Your listenership is what motivates me to continue to bring you great insights and great information, because we believe that as we provide good information, you're able to lean in and experience transformation that will propel you to think about ways in which you can have an influence within your spheres of influence. So thank you so much for being a part of this process. We don't want to just educate you. We want to motivate you to think differently about yourself and your place within this world. Enjoy this great episode with Reverend Marcus Allen. He is one of my colleagues, and this hits close to home. It's a very specific and personal insight about how this one African-American woman, older African-American woman in Milwaukee, Wisconsin, was treated when she certainly provided COVID-19 symptoms. Listen, this is why we're calling for Wisconsin state of emergency. Hey, good people. Grits or cream of wheat? Who the hell is racist? Does anyone ever ask if they touch your hair? Black Like Me.
You're listening to Black Like Me with Dr. Alex G., a podcast that invites you to experience the world through the perspective of one black man, one conversation, one story, or even one rant at a time. Here's Dr. G.
Black Like Me. Hey, good people. I want to welcome you back to another exciting episode of Black Like Me with Dr. Alex G. I have a good friend on the show today. We're going to talk about the impact of COVID-19 here in the state of Wisconsin on loved ones. And so I'm going to be asking him about what's happening with his family in Milwaukee. And, but you know, as I always do, I like to use black icebreakers because there's so much serious stuff that's going on. I think we need just a little bit of goofiness and seriousness in our lives. And so my special guest is Reverend Dr. Marcus Allen, who is the senior pastor of Mount Zion Baptist Church here in Madison, Wisconsin. So Dr. Allen, welcome back to Black Like Me.
Thank you for having me.
Man, we got some serious stuff to talk about, but can I just, as old folks would say, can I just cut a fool for a minute and that's just ask you some black icebreakers?
It wouldn't be you if you didn't.
I know you answered this before, but I think Mitchell was on with us. But let me ask you by yourself. Are you a grits or cream of wheat man?
I'm really not either. I'm a rice. I like rice more than grits, or I don't know what cream of wheat is.
It's white people's grits. That's what cream of wheat is. It's white people's grits.
Yeah, but I'm not a big fan of grits like that. But
really,
growing up, my mom, we used to cook the grits, but you had to put the jelly inside the grits, and
jelly inside the grits.
Jelly, sausage, eggs, mix everything in it.
Now you know what? Okay, I'm with you because even to this day, I cooked some grits the other day. My daughter likes to come home on weekends and wants me to cook, and I'm trying to show her how you get a bowl. Anybody can put grits on a plate, but you break your scrambled eggs up in it, you chop your sausage up in it, or your bacon, and then if you do put jelly in your toast, then you break it up there and make it like one of them bowls. Man, you making me hungry. Man, listen, someone just asked me this the other day. So this is the newest question on my Black Icebreaker. Never asked to anyone else before. You're the first one. Growing up, that you or family members put bleach in dishwater?
My mom did. Yeah.
because my white friends are laughing because they're seeing this on the internet. So they're saying, Tyler, ask Dr. G, do Black people really put bleach? Would your mom do it all the time or just when she had special guests?
All the time.
She would put bleach in dish. Now, would she use Playtex gloves or was she just old school? Just put her hands down in that bleachy water.
What are those? What are those? Yeah, we just put a little, not a lot, but like a capsule or a little bit less than a capsule.
Yeah, I get that stuff. It gets that stuff clean, man. You know, Nehemiah owns a couple of houses where we have men who just come out of prison where they live. And we're talking about, you know, the cleaning agents and things that we want to use. And my reentry director just said, Pastor, you know, we got bleach. And so it's funny, bleach and Vaseline, like Black people can use that stuff and clean a house and clean a cheering.
Oh, yeah. Cut them up, lube them up.
Oh, my goodness, man. Let me see what else.
That's all I use because I'm allergic to scents. So
are you really?
Yeah, I can't wear cologne or any like lotion with scents in it. So if I wear any of that, it gives migraines.
Man.
So Vaseline is that's all I use.
That's all you use, man.
Great Vaseline. I probably got about 5 or 6 tubs around the house somewhere.
Wait, and the fact that you call them tubs and not jars. The fact that you call them tubs of Vaseline.
Yeah.
Man, listen, you pastor a wonderful church. It's a Baptist denomination in, you know, here in Madison. Is one of our strong beacons of light, encouragement, political support, education support in our community. But if something happened over your PA system on a Sunday morning and the electric slide just started playing, like you know, not in the middle of preaching, but let's just say like, you know, maybe right before announcements, is there a good likelihood that some of your deacons or people would get up and actually start doing the electric slide?
Probably about 75%.
Would just start to, it's electric. I mean, they would just get up.
Engage immediately. You won't have to ask. You won't have to ask nobody to get up. You won't have to tell them to do anything immediately.
Immediately when they hear that, what is it about Black people? Oh my God.
To the left, to the right.
To the right, to the back. Oh, yeah, man, that's crazy. Man, that is crazy. And ours too. Our people ain't got this. Last question. Did your grandmother, like one of them Medea, Tyler Perry kind of house coats, and if she did she used to wear one of those?
Nightgown. That's what it's called. That's what it's called, a nightgown.
Not a gown, but a nightgown.
Yeah, that's what it's called.
Oh, Lordy. Because I know people nowadays give them fancy names like moo-moos, but no, it's a nightgown, or my grandmother called hers a duster. I don't know why they call them, that sounds nasty, but duster, a nightgown. Oh, my God. And they could wear it around the house anyway. Oh, man, I love laughing at and with Black people because we do stuff, and it's not until other people ask us about it. So like when Tyler told me, I think it was his sister, Abby, now we'll give you this free answer, but in the future, Abby, you need to listen to Black Like Me. She said, Tyler, ask them about the bleach. Like, we don't even think that other people don't do it until people ask us, why do Black people put bleach? So anyway, that's just
dishwater, mop water,
all that stuff, man.
Especially the restaurant and bathrooms.
Oh my goodness, that's right. Because they listen.
I used to wake up with a headache. And my mom, she cleaned the house.
Oh my god! Particularly that ammonia.
I could handle it. She could handle it.
She could. Old school, because she grew up on it. Old school. She probably put a little bit of it in her tea just to cut the flu. Man. So listen, speaking about your mother and family members, man, I was really touched. We both are doing ministry here in Madison. Folks in our congregations know and love each other. We've been in partnership forever. You know, growing up, I grew up right down the street from Mount Zion. Many of my family members went to church there. But my heart was touched because we know that COVID-19 is breaking out. I saw a Facebook post about your mother having contracted COVID-19 and just had a horrible response. And so I'm just going to shut up a minute and just let you talk about it. Well, I lied. I'm going to say this one thing. I posted something around the same time you did, just saying everyone's acting like Black people are dying because we out doing drugs and we drinking and we poor and we don't have access to health care. But what people aren't telling is that we don't always get the kind of treatment. Like I mentioned, my doctor told me not to get a prostate exam. I'm a 56-year-old Black man with hypertension. How are you going to tell somebody not to do something that's really routine? So part of what the arm that you are sounding is for America, because people listen to this, man, all across the country and the world. Stop acting like Black people don't have insurance, don't have access. We scared to go to the doctor. No one's talking about the treatment we get once we do feel that we're sick or when we're high risk. People don't listen to us, doctors and health professionals. So tell me a little bit about how things unfolded. Because the last time I checked, man, there were like 6,000 views on Facebook about your rant about your mom. And as Black men, we are who we are because of our mothers. Fathers may or may not be in the picture, but mothers are sacred to us. When somebody messes with our mother, that's like spitting on a cross or something. Talk to us about what's going on and why this is so clear to your heart, bro.
Well, these last 2 weeks have been very challenging for my mom, my aunt, my family, and since my mom went to the hospital and diagnosed, I started doing research, try to figure out how she was treated, what caused her not to be tested, and the more research I did, the more angry I became.
It's justified, brother. It's justified.
I learned back. I called her doctor office. March 19th was her first visit to the doctor, and it said she had a sinus infection. March 19th. All right. March 31st, she goes back to the doctor with a severe cough. They said it's bronchitis. But she has a fever, or she had a fever, took some Tylenol. By the time she got to the doctor, the fever probably was down. But she has a fever. She has a severe cough. She has wheezing in her chest. So,
a cough, wheezing, and temperature and earache. Nobody thought to test her.
Nobody thought to test her. April 6th, she has a phone consultation with her primary care doctor, which again, my mom's thinking she not claiming it. You know how we do, not claiming it. She thinks she got bronchitis, so she asked her doctor to give her a prednisone because it worked in the past before. That's all the doctor does is prescribe her prednisone without even saying you may have the COVID-19. I talked to the doctor personally. The doctor suggests that she tells my mom if her condition gets worse, then go to the ER. But never tells her, hey, you may have the COVID-19. These are the steps you need to be doing while you're at home. Never tells my mom this type of stuff.
So no precaution to protect family members in case she does have it.
Right. And when she went for on March 31st, they just told her to stay in the house for 14 days. Now, my mom is a caretaker. She takes care of my grandmother, which is her mom, 86 years old.
Okay.
And she and my younger sister still live at home, and she has a 3-month-old baby. Mom is at home. She's suffering all last week, every day, Monday through Thursday. I can hear the decline in my mom breathing and the severeness of her cough. I talk to her every day because
Sure.
I didn't want to also say, Mom, you probably got that stuff. I didn't want to because I ain't scared or nothing, but I was like, yo, you need to call your doctor. So she called. She said she called on April the 9th, but there is no record of her calling the Aurora healthcare primary care doctor. There's no record of her calling, but she said she called and they never called her back. And this was on April the 9th because we told, don't go to the hospital, don't go to the doctor. If you're having the symptoms, call first and then see what they say. So those are the instructions I was giving my mom. And she calls and no one calls her back. And that's with Aurora. And so I talked to Aurora about the clinic manager, I talked to her nurse, I talked to her doctor. And their policy is if you do not have shortness of breath, they will not test you. Only if you have shortness of breath, that is the only time that they will test you.
Is wheezing not considered shortness of breath? Because I thought wheezing was shortness of breath.
The CDC says if you have consistent pressure in your chest, if you have bluish lips, if you have shortness of breath, and I forget the fourth symptom is to seek for emergency care.
Right.
But if you have a fever, if you have a cough, and you have not third one, I forget the third one. It's just symptoms you can stay at home with until things progress. So I've been doing all my research on that and stuff, trying to figure it out. So she called Thursday morning, never heard anything back from her provider. Thursday night, she was saying she was coughing and she couldn't hardly breathe. So we called 911. Her fiance came to the house. At least her fiance, I called him, like, hey, get my mom to the hospital. Then while I was thinking about it, I was like, no, I don't want you to get in the vehicle with her because she had this COVID-19.
Right.
So I tell him to call 911. We call 911 and the fire department come to the house. I think the new stipulations, the new rules are they will not go in the house unless you are passed out. So they asked my mom to come outside. They bring her outside. She put on a coat, give her a mask, put a mask on her, and they check her vitals. The guy tells her that he hears something wrong in one of her lungs. She tested herself. She gave her own fever, tested her own fever. She had 103 fever. She has a severe cough.
103.
103. She has a severe cough. She has shortness of breath. She has an earache. She's lost a sense of taste and smell. And the 911 responder from the fire department it advises her not to go to the hospital. Now, of course, all of us could have said, no, you're going to take her, but all of us also are fearful of the fact, if she goes to the hospital, it's a chance she can get this virus with the symptoms that she has, so we want her to stay out. And I'm pretty sure, Black people women, nobody want to stay in the hospital. So if he told us, go or not go, but I'm telling you to stay here so you do not get the virus, of course, we took that advice. Mom also stated that they didn't even test her fever. Said while they was out there, all looking at each other like who has a thermometer, and no one even checked my mom's fever from the fire department.
Wow!
And they left.
Wow!
They left, and at this time, if 911 is called, family's gonna come over.
Sure.
And so my family stayed outside. They stayed away from her until they got that clearance. Now they didn't tell her hey, you may have this, so go to your room, stay in your room, don't come around anyone because it's very contagious.
They told her to stay in the house, not the EMT, but she was told earlier to stay in the house.
Right, and
but
then
they didn't tell her how to protect her relatives.
The EMT didn't give her any information on that neither.
So this, I just got to say, this is the background story that people got to know.
Right.
Dr. Allen, a lot of my listeners are white trying to navigate this space. They lean in to understand systemic realities like this, to understand why we don't trust many medical professionals. How is it not standard operating procedure to tell someone who's presenting with a temperature, something in their lungs, they're older, they represent standard symptoms, and not even say, stay away from your kids, not even ask, who do you stay with? You said your sister with a 3-month-old baby stays in that house. How do you not protect folks? And so when people are stepping back and they're hearing about all the deaths in Milwaukee, they're thinking, again, I'm just reiterating it, poor Black people don't have attention. She's calling Aurora. That's not a free clinic, people.
Right.
She's calling her health provider. EMT comes. She's doing all the right things, and she's not being told what to do to protect herself or her loved ones.
Right. And that's that angers me the most. Now, Aurora,
of course.
Also because they were not intentional of making sure that my mom understood anything about this virus and what she may have had. My mom has pre-existing conditions, hypertension, and she has blood clots. And when I talked to the lead clinic, she stated that the doctor followed all protocol according to the algorithms. But I say, so when do numbers don't matter when the person that you're talking to has been to your office or talked to one of your doctors for 3 weeks,
right,
with the same symptoms that refer to you that you may be in COVID-19, and I think that was mishandled. the EMT coming to the house. I don't know if with the fire department come to the house and leave my mom in the house and tell her she shouldn't go to the hospital when she's having shortness of breath. I'm pretty sure her chest is hurting. She has a severe cough. She has a fever of 103, but you don't even check her temperature, earache, loss of taste, smell, and you leave her in the house. And that was on Thursday. On Friday, I called my mom, and while I was talking to her, just checking on her, and she was breathing like.
You could hear that in her voice. Oh, come on, man.
I'm talking to her, and I'm like, what are you doing? She's like, I'm laying down. So I knew if I am not a medical professional at all, Pastor
Right.
G.
That's right. Your doctorate is not in medicine.
Not in medicine at all. I'm not a medical professional. I know nothing. All I know is what I see on the news. And at that time, I hadn't done much research. But now, because it's affected my family in such a massive way, I've been doing research on it. So then after that, I called her primary care doctor myself. I called them myself. I talked to them, and I told them what was going on with my mom. I told them her symptoms.
And they spoke with you because you don't have power of attorney for your mom, correct?
Right.
So
I don't have power of attorney, but I have access to her.
Okay, that's good. Okay. So people need to get that if they don't, so that they can check in on their parent. I have it with my mother. My mom has dementia. I can do that. But others, if you got it, I want you to listen to what's going on.
Yeah.
Get that set up.
So she got it set up where I can speak on her behalf, talk to them about her medical records and stuff. So I called them and told them about my mom, told them what's going on. That's how I was able to get all the dates and stuff.
Sure.
The doctor, what did she go to the doctor for? And then they called my mom and told her to immediately go to the hospital. Now, again, my mom's fiance now has to get in the vehicle with her, and she's having all of the symptoms. But now we're seeing why community spread is happening. This reason. Now, of course, a lot of people are doing what they're doing out in these streets. They're gathering.
But this isn't that.
But this is not that. This is my mom's sick. She stayed in the house. They allowed the fire department, I believe, should have said, hey, you all do not need to be here. She may have COVID-19. My younger brother was there, my sister, her fiance, and the 3-month-old baby, all standing outside because no one went in.
Dear Lord.
Because they was just responding to the 911 call. And when they gave the clearance, everybody went in the house.
They went
around
right.
my mom.
Let me ask you this, Dr. Allen. If a 60-year-old woman with pre-existing conditions, wheezing, shortness of breath, 103-degree temperature, cough, loss of taste, earache, loss of smell, if she's not going to the hospital, who the hell is going to the hospital then?
I don't know.
Who is the EMT? Who's being taken to the hospitals? Because with all these classic things, we're hearing about hospitals being overrun.
Right.
Who's at least getting to the bed? We're not even talking ventilator now. Mm-hmm. Who's getting through the receptionist to the doctor to get to the hospital rooms? If your mother, with all of this that's being presented, we know Milwaukee's a hot spot. We know in the state of Wisconsin, 49% of the deaths are Black people. You're beginning to bring some light to this situation and helping us to understand why that might be the case. Because we're like 6% of the state's population. We're only like 29% of the cases, but we're 50% of the deaths.
That's why I was wondering, even with her primary care doctor, I talked to her and she was like, I know your mom, I know her well. And then I was like, why do you treat her like you knew her?
Right.
She has pre-existing conditions. She's been to the doctor twice. At least my mom said she went 3 times, but they only have record of her coming in twice and one phone call. So I don't know. My mom said she went 3 times and she had a phone consultation. And neither time did they tell her, hey, you may have COVID and this is what you need to be doing while you're at home. And so that information need to get out too, because they tell a lot of people, don't go to the doctor, don't go to the hospital, stay at home if you're showing these symptoms. But what should they be doing at home?
Right.
What precautions should they be taking? how should they?
Should they be masked? Should they be like go to a room that nobody uses? Like, give them something. I just heard on the news. I'm sorry, I'm gonna cut you off.
Yeah, the information should be given to them in document form, just like they do everything else. And I was wondering, like, why wouldn't you test to rule it out? And why?
Right.
Why wasn't it never considered that my mom may have this virus? But according to Aurora, they only, at least the doctor and the clinic and the nurse, the clinic supervisor and the nurse said, Aurora only tests if you have shortness of breath. Now, my aunt was tested positive also.
Lord,
for COVID-19.
That's right. You mentioned that,
but she went to the doctor one time, and then she called the doctor back again, and he sent her to a respiratory specialist that tested her ASAP. He said, I know, and my aunt said, he told her, I know you don't have all of the symptoms now, but I need to test you.
And that's a different health system? I mean, that different than Aurora?
I don't know which one it is, but it's a different health system. I forget. I have to ask my aunt which one it was. But my mom was showing so much worse symptoms than my aunt, and she couldn't get tested.
And again, I'm going to sound like a broken record, man, but who then gets a hospital bed? Because let me tell you, the EMTs are not bringing ventilators to houses. Right. Man, I'm in conversation. You and I are community leaders, not just with Black folks, but in general. You and I get called into a lot of places to listen to discussions. I've listened to health professionals talk about the fact that they are working on criteria development for who gets ventilated. What's frightening me is your mother's not even in a position to be told eeny, meeny, miny, mo if she's not in the hospital.
Right.
So is there some algorithm that they've got out there that if you're Black and a woman and single and pre-existing things, that a ventilator or hospitalization would help you is such that we won't even bring you in? My question is, are they making decisions about ventilators while Black people are still at home? And, and I don't even mind sounding like a conspiracy theorist right now, because this, like I said, this is not just about somebody stepped in front of me at McDonald's and the white cashier took their order first. Clearly, when we were there first. It's not a matter of people thinking Tyler Nyland is Dr. Alex G and I'm his assistant. They couldn't fathom that this person was half my age could be my assistant and I'm Dr. Alex G. We're not even talking about petty stuff like that. We're talking life and death issues. We're already talking about a city like Milwaukee that's one of the most segregated cities in America. And it's got all these disparities, and Wisconsin has these disparities for Black folks. But man, folks aren't pulling back the covers and looking at what's really going on. That's why this interview with you is part of a series that's called Wisconsin State of Emergency, which I started filming before COVID-19 even broke. I mean, we started designing this late last fall before the end of the year. So this story just makes me want to help people to understand we're not just two brothers here ranting because we got a high hospital bill or nobody would take our mothers to the hospital. When you're presenting all of those things and you can't even get a test, it makes us wonder, is that why our people are dying? And I'm glad you're bringing attention to this, man, because this is horrible.
Hey everybody, this is Tyler, the podcast manager of Black Like Me. Just wanted to jump on and share 2 quick things about Black Like Me. Number 1, Patreon. Patreon is an opportunity for you, if you like our show at all, if you enjoy it, if you want us to keep creating this content, to be able to support us financially and to help us do that. If you're as little as $2 a month, you can join our team. We also have some other higher tiers with some more benefits if you join. So please go to patreon.com/blacklikeme to hear more. Number 2 is that if you are interested in having Dr. G speak, if you're interested in him doing some consulting for you, your organization, anything like that, you can go to alexg.com/contact and you can fill out a form to be able to see how you might be able to bring Dr. G to your business or your community. All right, back to the show.
I watch the news. I know they watch the news. I know they are aware the health risks for Black people who contract this horrible disease.
Right.
And matter of fact, Aurora put a video on their Facebook page telling Black people to stay at home and don't gather. So if you understand this, and they gave the statistics about how Black people are dying in Wisconsin. They know about it. Then why wouldn't you be more concerned about Black people that are coming in your office showing these symptoms and trying to figure out what to do? So that's my biggest issue also. And even the emergency responder that came to the house, you know what it is. You all know Milwaukee has made national news for how Black people are dying on the north side of Milwaukee. Still, no one thought it through to say, hey, this lady is really suffering from this. We need to see how can we help. There is no cure for it. There's no cure. There's nothing they can do, but what precautions or steps need to be in place to give some type of comfort as she try to navigate through this whole process. So she go to the hospital on April the 10th. Time she get there, they take her back. They didn't wait, take her back, and they test her. The next day, test come back positive. They put her on oxygen, and my mom is she Holy Ghost filled. Amen.
Right.
She is a strong believer. And when she went in, she was saying that she felt like she was about to die. That's how she felt, because she couldn't breathe. This is a horrible disease, Dr. G, and the way it attack your lungs and your breathing, I haven't experienced, but to hear through my mom, hear through my aunt, this is a horrible disease that is painful. That you can't even. My mom and aunt can't even sleep on their back. They got to sleep on their stomach or on their side, because the pain just by laying down that causes on your lungs. It's a horrible disease, and it's a painful one, and people need to realize this is so serious. It is so serious, and so my mom, she's in the doctor. She's getting out, but yesterday, she's getting better, man. That's the best thing.
Is she still in the hospital?
Yeah, she's still in the hospital. Initially, when she first went in, they wanted to put her on a ventilator, but they didn't do it. So praise God that now she's doing better, and I'm just praying for. I'm not a speedy recovery, just a recovery.
Just a good, solid recovery.
I just want her to take her time, get the rest that she needs, and also get better. But I'm highly upset with Aurora and with Milwaukee Fire Department.
Definitely. You need to be.
I'm grateful based off that, because of that video. So many people have reached out and trying to help me get in contact with the right people, even all the way up to the lieutenant governor, who has been reaching out to Milwaukee and reached out to the Department of Public Health for the state. The vice deputy called me yesterday, told her the story, told her what's going on, and that's because Lieutenant Governor and Lakeisha Myers, Lena Taylor, all of them, they reached out, and they've been making calls on behalf of my mom, and I appreciate that. I just don't want this to happen to nobody else. I've been hearing so many other stories of people. I even heard one family, a wife and a husband were found unconscious inside of their home. The wife is still living, but the stepdad died because of the coronavirus. And I wonder, why would they never go to the hospital, or why would it get to this point where they can die in their homes from this virus?
Right.
You understand what I'm saying? And because, Black people assuming, I'm not going to the doctor because they're not going to do anything for me when I get there.
Right. Think about this. They're trying to make it sound like we don't have insurance or access, but people are afraid that won't be treated fair. Listen, there was a Tuskegee experiment.
Right.
There's a famous, I'm drawing a blank on his name, but a famous gynecologist who experimented on Black women's bodies without anesthesia, and is still considered sort of the godfather of gynecological sciences. We have a history of being treated inappropriately. A doctor trying to talk prostate exam. There's this level of distrust that people with privilege don't have to think about.
Right.
Like, we're struggling. Like, we know that there are a group of people that are struggling to be insured. We're talking about people who are dutifully, aptly insured, and still can't trust that the medical professionals have their best interests. Do you know how scary that is, listeners?
Right.
Folks who are part of Black Like Me, do you understand how scary it is to have insurance, to have paid up premiums, and you don't believe that your doctor's looking out for your best interest? Why would we not think that these EMTs and others are gatekeepers to keep people out of the hospitals so that there are more? It's for who? Like, who do they think should be in those beds? Who do they think is deserving of those beds? And what decisions are they making, intentionally or unintentionally, when you don't test someone's fever? They're presenting cough, wheezing, all these other kinds of things. What are we supposed to think? Is your aunt doing better, Reverend Allen? Is she home? Is she home or at the hospital?
She's been home the whole time. She was never hospitalized. So
how's your sister doing? Because you said she lives with your mother.
Yeah, my sister tested positive on Monday.
Oh, Jesus.
So
how old is your sister?
22.
Oh, Lord.
And so right now, that's what I'm wrestling with. You know, my mom, preferably, she'll get out the hospital soon. She got to have somewhere to go. But majority of my family may have this virus because of our interactions or their interactions with each other during this whole incident with my mom. And so I think it's just attributed to the spread and how it's affecting my whole family.
Man.
So it's challenging. And then I'm in Madison, I'm close, but I can't go. And I'm just trying to figure out ways. Now, they say my mom and my sister can live in the same house. They can't come in contact with each other. So the major thing I'm trying to, and both of them, my mom has a pretty nice side house where she can be in her room and have her own bathroom. And then my sister has her room and she has the bathroom in the hallway. But
is that for 2 weeks? What's the time frame that your mother needs to be separated from her daughter?
They haven't given that timeline yet.
Because we keep hearing 2 weeks, quarantine for 2 weeks, but
my mom been sick longer than 2 weeks now. You know what I'm saying?
That's true, because March 19th.
Yeah, she's been sick longer than 2 weeks. So I don't know, and I'm pretty sure they don't know either. You know,
sure.
It's just, you know, each day leaves, each hour things change things. So I'm pretty sure people don't know. So I just don't know.
You know, this is just changing the subject just a little bit, Reverend Allen, but I'm about to do my first online memorial service. You know, in our Black community, homegoing ceremonies celebrating the lives of Black people, particularly Black people who have had strong faith. They've been committed to their communities and their families. They've been a blessing and a pillar in society. Have you had to do any funerals yet, whether it's COVID-19 related or not? Have you had to do any funerals? Because the state has a mandate, like only 9 people are allowed to gather. So this is changing our line of work. You get somebody with 60, 70, 80 years of living and no more than 9 people. So were you present physically for the funeral?
One of my former members moved out to Las Vegas, but they still have family here in Madison. And I'm pretty sure you heard about a couple, 4 weeks, the 4 young men in a car accident.
Yes.
So one of the young men, I did his funeral on I think it was last week, Monday. And it's challenging for multiple reasons. One, for the funeral home. Because the funeral home only can let 10 people in. So they try to do like a 3-hour visitation period. For 3 hours, they let 10 people come in at a time for about 10 minutes.
Jesus.
And you know, we can't have large gatherings. So Foster Funeral Home.
Black-owned funeral in Madison, Wisconsin.
Here in Madison. This was a large family. This was a young adult who died. And only 10 people can come.
See, that's crazy. That's the piece that we're not talking about either. That's up to us.
It's a lot of pressure, but it's needed. I think it's needed to keep people from gathering. But it was painful to watch, but it was also painful for me to see family people still hugging on each other, still loving on each other with this virus. I know we shouldn't have been doing it. I know they shouldn't have been doing it, but it's hard.
But it happened.
And the parking lot was jam-packed with at least 60 to 70 people.
Oh.
And so they called the police on Foster Funeral Home. And police came.
The neighbors did?
Police came. No.
I didn't know that part.
Yeah, the police came, and I'm not for sure if they issued them a citation or not. But when they came, they asked them, can you all tell the people to disperse? And the police was like, no, we were told not to intervene in large groups like this. So how do you expect the funeral home with no security, with no one to really guard people from coming on the premises,
to do what the police can't do?
Do what the police can't do.
And this is 4 young people in a car accident. This is one of the victims.
Right.
It's tragic. Every year in the spring, it seems like around graduation time, or in the spring, there's some tragic story of some young lives being lost. It's ripping parents, families apart. Why would you think they wouldn't gather?
It was one of the toughest funerals I ever done, and I'm in there with gloves on and with a mask. It felt so. And I'm a people person. I didn't know him, so normally during the funeral time, I connect with the family, talk to the family, but I was unable to do any of that because of this virus. and I know it's well needed, but it's challenging.
It's
very
challenging,
challenging
Jess.
for families
Yeah.
who have loved ones to pass away. I can only imagine in like New York, with so many deaths, of how people are trying to handle this, how they're trying to manage it. Italy I saw on the news a couple of weeks ago in Italy, they just had coffins in the church, and the priest is going around and praying over the coffins
Lord,
because
it's
family members can't come.
it's
It's so
it's
challenging, and so it's discouraging, but the challenge. And I think it's the right call. But I also witnessed Don at Foster Funeral Home trying to manage all of that chaos. Like, you can't come. We go to the cemetery. We tell them, yo, you got to stay in your vehicles, or if you get out your vehicle, you got to stay near
the
your
people
vehicle.
listen.
But this is a large gathering. No, they wasn't. No, they weren't listening. And I felt so, because I did the graveside committal, and I ran up out of
I
there
don't blame you, because you
because
got
there
to
was so many.
be there for
Yeah,
you have young kids
right.
and
Yeah,
a family. Man,
yeah.
so
So I did the middle. I got out of there because Dawn, she was trying to tell them, stay in your vehicles, stay at the if y'all get out, 10 per vehicle, but make sure you space out. And they got called. The police called on them again at the cemetery when they got to the cemetery.
who called the police at the
So
cemetery? The cemetery workers?
somebody, not the workers. I don't know.
Probably
Somebody
somebody in the
did.
party, man. But listen, I was talking to some friends, and they're asking me about how we're taking our services online. You and I have figured out how to do that. I said, taking our services online is not difficult. This was about 3 weeks ago. It was difficult. I've got to figure out how to do a digital funeral. So I'm speaking up for a funeral, going to be a national on Saturday,
Wow.
and the person won't be there, so there's not a physical gathering. But we got to really rethink this, because again, we don't just call them funerals; we call them homegoings in our community, celebrations. And so, man, just from one pastor to another, you're my thoughts and my prayers, man. Not only for the well-being of your mother, thank God she's feeling better and hopefully coming home soon. We'll be coming home soon, and your aunt. But we're also praying for your sister and for the baby and your mother's fiance. It's a lot going on. But man, your story is very heartfelt. It's very personal. It's very real. But in doing this expose on the state of Wisconsin, I want to bring national attention to what's going on, because you're not going to blame the victims. We have these stress-related illnesses, and they're already predetermined that we can't get ventilators because we can't get rides to hospitals. I mean, your sister or fiance may not, or your mother's fiance may not have been exposed. Now, she's been in a house, so probably some exposure anyway. But typically, when someone's sick, we drive them. And so it's just so much that's going on.
If I never called on Friday,
man.
she would have just stayed at home, because that's what the MT
right.
told her to do.
Right.
And
Right.
that's what Mom said. Mom said, I did everything they told me to do. Everything they told me to do. And that's also a mentality that we have in the Black community, to trust those who are over us.
Right. Exactly. But think if they got white jackets on or stethoscopes around their necks, we think that they're looking out for our best interest. So when you and I find out that they don't, I'm trying to tell people that's scary. Right. So man, so I appreciate you keeping your voice out there, pushing. One thing I want to ask you, I'm sorry, what's that, sir?
I appreciate you having me on, but
man.
I'm sounding off from the mountaintop, man. It's
No, I need you to do that. Another thing, I hope that while you're getting information, I hope that they answer for you, and hope that you can push it back out here to the community. Of the 50%, the 49% of folks that are dying, of those who died, how many of those are actually on ventilators? I need to know in the state of Wisconsin, how many Black people are dying at home and how many are dying in hospitals on ventilators? Because nobody's telling us yet how many Black folks are getting ventilators. And listen, this is Wisconsin. They ain't that many of us anyway. So that's something else, Dr. Allen, that we got to broadcast. How many Black folks are getting access to ventilators? So man, listen, I know that there's stuff you got to get to today. You got a Bible study and stuff, but I appreciate you, your work, your ministry. You reached out to the Ministers Alliance, it's our AACC. People don't know that you're the president of our Black Ministers Alliance, and you reached out to us right away when you found out about your mom, and we started praying and crying out to the Lord. So thank you for being so transparent with your story and helping to bring some attention, because hopefully that will mean ventilators for us, masks for us. But if folks are going to treat us wrong, we're going to sound the alarm. We're going to let people know all over the state, all over the country, all over the world. We are not dying because we want to. We're dying because people are making choices for us that aren't good. So So folks, listen, this has been another powerful, insightful episode of Black Like Me with Dr. Alex G. And as always, we keep trying to bring good information to you so that Black people, you know that folks have your best interest at heart, and we are voicing for the non-Black folks. We want you to know what's really going on. We're not a bunch of paranoid men trying to make up stories. These are things that have affected our community as well, as long as we've been on American soil. So I need y'all to lean in. I need y'all to subscribe. I need you to listen. I need you to ask questions in your communities where you're listening, where you're hearing about these off-the-chart records of Black people who are not doing well. Ask the probing questions. Share this audio with friends who are nurses, doctors, EMT. Have them listen to it because it might save Black lives. Don't just listen and be entertained. Listen to this and take some action. Subscribe, go to the Patreon page, listen to the things that we're doing, stay close, but share this with people who you know are in the field, because it might help them to make a more judicial and a more equitable decision that will affect a Black life who touches so many folks in their community. So you all have a great day. Stay safe, be blessed, and thank you for being a part of Black Like Me. Ooh, Black Like Me, yeah.
I want to thank Corey Saffold for creating the music for this podcast, my podcast manager, Tyler Nyland, engineer and editor, Eli Steenlich, my editor, Jeremy Holliday, and a special thank you to WORT Studios, where we record Black Like Me.
Ooh, Black Like Me. Thank you for listening to today's podcast. You can find out more about Dr. Alex G's amazing work at www.alexg.com. Black Like Me is sponsored by the generosity of the Human Family Unity Foundation. Ooh, Black Like Me.